Chapter 4: Psychosis and Schizophrenia. Let's start with symptom dimensions in schizophrenia and clinical description of psychosis. Psychosis is a syndrome, that is, it is a mixture of symptoms. It can be associated with many different psychiatric disorders, but is not a specific disorder in itself in any diagnostic schemes such as DSM-5 or ICD-10. At the very basic, psychosis means delusions and hallucinations, and generally also includes symptoms such as disorganized speech, disorganized behavior, and gross distortion of reality. So on the whole, psychosis can be considered to be a set of symptoms in which a person's mental capacity, affective response, capacity to recognize reality, to communicate, and to relate to others is impaired. The disorders that require the presence of psychosis as a defining feature of the diagnosis include schizophrenia, substance-induced psychotic disorders, schizophreniform disorder, schizoaffective disorder, delusional disorder, brief psychotic disorder, and psychotic disorders due to a general medical condition. Disorders that may or may not have psychotic symptoms as an associated feature include mania, depression, as well as several cognitive disorders such as Alzheimer's dementia. Now, psychosis itself can be paranoid, disorganized, or depressive. And perceptual distortions and motor disturbances can be associated with any type of psychosis. Now, perceptual distortions include being distressed by, first, hallucinatory voices, that is, hearing voices that accuse, blame, or threaten punishment, or seeing visions, having hallucinations of touch, taste, or odor, or seeing that familiar things and people seem changed. Motor disturbances include peculiar rigid postures, overt signs of tension, inappropriate grins or giggles, peculiar repetitive gestures, talking, muttering, or mumbling to oneself, or glancing around as if hearing voices. Now let's discuss paranoid psychosis, in which a patient might have paranoid projections, hostile belligerence, and grandiose expansiveness. In paranoid projections, the patient might be preoccupied with delusional beliefs, believing that people are talking about oneself, or believing one is being persecuted or being conspired against, or that people or external forces control one's actions. Now, hostile belligerence might be expressed in the following ways: feeling or manifesting hostility, attitude of disdain, sullen attitude, manifesting irritability or grouchiness, tending to blame others for problems, expressing feelings of resentment, or finding fault and expressing suspicion of people. And finally, grandiose expansiveness is exhibited by attitude of superiority, hearing voices that praise and extol, believing one has unusual powers, or is a well-known personality, or one has a divine mission. Now let's discuss the second type of psychosis, which is disorganized or excited. In this, there is conceptual disorganization, disorientation, and excitement. Conceptual disorganization can be characterized by giving answers that are irrelevant or incoherent, drifting off the subject, using neologisms, or repeating certain words or phrases. And disorientation is usually tested on the basis of time, place, and person, as in, the patient might not be knowing where one is, what is the season of the year, or which year it is, or even one's own age. Now, in excitement, the patient might be expressing feelings without restraint, may manifest speech that is hurried, may exhibit an elevated mood, may have an attitude of superiority, dramatizing oneself or one's symptoms, may manifest loud and boisterous speech, may exhibit overactivity or restlessness. Now let's discuss the third type of psychosis, which is depressive, which is characterized by psychomotor retardation and apathy, and second, anxious self-punishment and blame. Now, psychomotor retardation and apathy are manifested by the following: slowed speech, indifference to one's future, fixed facial expression, slowed movements, deficiencies in recent memory, blocking in speech, slovenly appearance, whispered speech, or even failure to answer questions. Now, anxious self-punishment and blame is the tendency to blame or condemn oneself, anxiety about specific matters, apprehensiveness regarding vague future events, an attitude of self-deprecation, manifesting as a depressed mood, expressing feelings of guilt or remorse, preoccupation with suicidal thoughts, unwanted ideas, and specific fears, and even feelings of being unworthy and sinful.